Okay, we might get started. So, welcome everyone this afternoon, and thank you for joining us today for our webinar on exercise and lymphoma. We're running this in conjunction with our May Legs Out for Lymphoma campaign, which I'm sure you've gotten emails about. I'm Liz, one of the lymphoma care nurses, and I'll be your host for today's session. Just before we dive in, a few quick housekeeping items. So we do encourage your participation. So if you have any questions, please put them in the Q&A function at the bottom of the screen. Just noting that the chat function won't be monitored today. There will be a small amount of time at the end to answer these questions. If you do miss anything or you would like to re-watch the session, it is being recorded and it will be uploaded to our website. So a link will be sent to your email once this recording is available. So we'll do that to everyone who's registered today. If you do have any technical issues during the webinar, please email nurse@lymphoma.org.au and we will try to address this for you as one of our nurses is monitoring the email as well. So today we'll be hearing from Sharyn Wappett, an experienced physiotherapist and director of Restore Oncology Care and Lymphoedema Clinic in Sydney. Sharyn has over 25 years of experience in the management of side effects of treatment for cancer, in particular lymphedema, cancer-related fatigue, physical decline, post-op scar tissue, and cording. Sharyn is passionate about providing a holistic approach to patient care and will share her insights on the importance of keeping active, managing the side effects of treatment, and maintaining and restoring your quality of life despite a lymphoma diagnosis. So I will now hand over to Sharyn to go through this. Thanks, Sharyn.
Thank you, Liz. Thank you to Liz, Nicole, Kimberly, and Charlotte for organising this and inviting me to speak. I'm always passionate to speak about exercise and the benefits with a cancer diagnosis. So thank you for thinking of me. So yes, as Liz said, I'm a physiotherapist, but I'm a normal physio, but I have worked pretty much in oncology for the last 15 or so years, predominantly as a lymphedema therapist and a cancer rehab therapist. And I now work with a team of allied health professionals, and we work to try and help prevent the side effects of the treatment and encourage or help people restore their quality of life. So today we're going to focus on exercise and the benefits of exercise. We can talk about a few other things, but that's going to be our main focus. I'm going to touch very, very briefly on lymphoma and the lymphatic system, but then we'll move into exercise and how it can benefit you. So what is lymphoma? And you would all have a good understanding of this, but it is a cancer that starts in the lymphatic system. Your lymphatic system is a vital part of your immune system that helps fight infection and disease. And so lymphoma is cancer of your white blood cells, your lymphocytes, which can start to grow out of control, and that can then affect how your lymphatic system is working. Your lymphatic system is a crucial part of your immune system. It's made up of lymph nodes, lymphatic vessels. We have some organs in there as well, the spleen, thymus, tonsils, bone marrow. We have lymph fluid. So the lymph is just fluid that sits in the tissue normally. That's where it normally belongs. And it becomes lymph when it enters your lymphatic system. And we process lymph fluid all through the day. So that's what lymph is. The lymphocytes are part of your lymphatic system. So your T cells, your B cells, and your natural killer cells. And they are made in the bone marrow. And we know that the T cells and the B cells, they help to fight pathogens or fight infected cells. So they're a big part of your immune system and fighting infection. We have approximately 600 to 700 lymph nodes in our body all throughout. So you've got lymph nodes in your armpits, in your groin, through your head and neck, through your whole body. Their job is to filter the lymphatic fluid, take out any harmful bacteria, substances, and then it returns the lymph into your circulation. And we filter 2 to 4 litres of lymph a day. It's an ongoing thing. So in terms of treatment for lymphoma, we know that there's a number of different options. And what I want to focus on today, I'm not going to go into depth about the treatment, but more how exercise can help the side effects of that treatment. So chemotherapy, radiotherapy, immunotherapy, all these treatments will come with side effects. And what we want to try and do is help prevent those side effects as much as possible, and help restore and maintain quality of life. We know exercise plays a very important role in trying to help prevent some of the side effects of these treatment options, which may mean that you're then more able to complete your dose, for example, of chemotherapy. So we'll move straight on to how effective exercise is. So some of the things that exercise can do, it can help reduce cancer-related fatigue. It can help improve your sleep. It can help with your mental health and certainly your quality of life. It maintains and improves your physical function. It supports your immune function, which is obviously very important with lymphoma. It will help decrease the side effects of the treatment. There's some evidence to suggest that exercise can actually help suppress tumour growth. And we'll talk a bit more about that later on, but that's just a few of the things that exercise can help with. So the first thing we're going to focus on is cancer-related fatigue, as this has got to be one of the most common and distressing side effects for people undergoing treatment for lymphoma and all cancers. It's quite different from typical tiredness. So it's not fatigue that will necessarily be relieved by sleep. So you might feel tired and think that the more you sleep, the less tired you're going to be. But sadly, with cancer-related fatigue, it's not that simple. But the good news is we know that exercise is evidence-based and it will help. And you might be thinking, but I'm tired, how can I possibly exercise? And again, we'll talk about that. But it is about trying to keep your body as strong as possible to manage your day-to-day function. So here's a bit more about how that works. So firstly, some of the treatment you have, the chemotherapy, radiation, it can impair your cells, your mitochondria. The mitochondria are like the powerhouse of your cells. They produce energy. And we know that these radiation and chemotherapy can damage those cells and the mitochondria specifically. And we know that exercise can actually help boost the mitochondrial function. So by maintaining just even a low level of exercise each day, preferably, we can help those cells be more productive. The more energy the cell has, the more energy you will have to be able to perform your daily tasks. One of the most important things about exercise is maintaining muscle. So it's very common, even if you are an exerciser before diagnosis, when you get a diagnosis, it obviously is very upsetting, distressing, and you quite often you're straight into whether it's treatment, it happens often very quickly. And so you lose your momentum, but also then you start to feel unwell potentially. The chemotherapy, you may be nauseous, you might feel tired, just for whatever reason, you might actually stop doing some of those exercises that you were doing before. So you start to get weaker already. You'll lose muscle. You lose muscle within a week of not doing any exercise. Our heart, our lungs, they're all muscles that need to be worked. So they're going to start not working quite as efficiently as we need. So it's super important to try and maintain muscle. So obviously doing exercise, and in particular resistance type exercise. So there I'm talking about weights, body weight, even exercise, using some TheraBand, but the focus is just trying to build muscle. So the more muscle we have, the easier we can do things like walk up and down stairs, or carrying groceries. So you're going to start to feel more tired doing those daily life activities the weaker you become and the more muscle you lose. So we definitely want to try and maintain muscle. Exercise helps maintain our cardiovascular and lung function. So when we do aerobic exercise, such as walking, cycling, swimming, that pumps our heart and our lungs. And the stronger we keep our heart, the more efficient we maintain our lungs, the more oxygen we're going to have pumping around our body. And we need oxygen for our body, for our cells to work. And our muscles, they need oxygen to do their job. So we really want to keep our heart strong. Some chemotherapies can affect the heart. So again, it's just in terms of trying to help prevent the side effects of the treatment, we really want to do things that we know are going to help preserve our heart function. It can improve your sleep and your mood. So just by doing a little bit of exercise, it just will help calm your body down a little bit, but it also does make you possibly a little bit more fatigued in the evening when you're ready. And then so when you go to sleep or go to bed, you can sleep. It definitely helps your mood. So we know that when we exercise, our brain releases feel-good chemicals. So our body is quite an amazing system in itself. We have a pharmacy within our body. So when we exercise, we release good chemicals that make us feel better. So, I mean, I understand how difficult it can be to sometimes get to exercise, but I can guarantee you, if you can get yourself there, you will feel better afterwards. So yeah, definitely trying to get those feel-good chemicals, the endorphins, releasing so we can feel a bit stronger. One of the things about exercise is it does give you a sense of control. So certainly having a diagnosis, it's overwhelming and there's a lot you can't control. You can't control that you've been given this diagnosis. You can't control what treatment. Well, you may be able to control it to some extent with choices, but at the end of the day, you have to undergo some treatment to try and help kill and cure the cancer, and that brings about all these side effects. So we know that there's that loss of control and that creates more overwhelm. But one of the things you can do is exercise and you can control that. So it just can help give you a sense of doing something positive for your body. You know it's going to help in so many ways, that it helps empower you in a situation where you may not be feeling too empowered. As I said before, it helps improve your mood by releasing some feel-good chemicals. It's going to improve your strength, your balance, your confidence. Part of that muscle loss, that strength loss, is losing some confidence. You lose faith in your body. What can I and can't I do? You may lose balance because you're not moving quite as much. You're sleeping more or resting more. So we lose balance, which can then cause loss of confidence just in terms of trying to move around and go for a walk. It improves your sleep. It might help you to maintain some independence. So by maintaining strength, you may feel that you can do more for yourself, such as, do some shopping or maybe drive the car. Whereas if you're losing strength and confidence and balance, then you may be less inclined to get out and do those things for yourself. One of I think the great things about exercise is connecting with other people. So it is a time of life that's very confronting, and by possibly working within a group session with other people who are going through something similar, there's a sense of camaraderie, some support, and it can be a really beneficial thing to not only compare notes with other people, but just have that support from other people who do 100% understand what you're going through. We know that exercise really helps your immune function. And again, with lymphoma, this is super important. So even just regular, gentle exercise can help your immune system to stay stronger. So when we move, it moves our lymphatic system. So it pumps the lymphatic system. It's a network of vessels, as I said before, and lymph nodes. Now, these vessels, they're not like the heart and blood system that has a pump. They don't have a pump. So what helps move the lymph through the body is muscle. So when you move, you contract a muscle, it contracts against the lymphatic system. That helps to move the lymph. So by moving our lymph through our body, we're keeping our T cells, our B cells, our natural killer cells, moving through the body. So it's going to help you pick up viruses, bacteria, and fight those things more efficiently. So we want to keep our lymphatic system as healthy and as functioning as we possibly can. We know that exercise can help reduce chronic inflammation. Now, short-term inflammation is normal. So if you have a cut or a scratch, it's normal to have local inflammation. That's how we fight these bugs or infection. However, with cancer and its treatment, it can cause chronic inflammation, which leads to more things such as feeling tired. You might feel achy, sore. You may have a brain fog where you just can't focus, you can't remember words, you can't think straight. It can make you slower to heal. We know that exercise, and again, fairly gentle exercise, it doesn't have to be hard and fast exercise, but it can actually help to calm inflammation back down. So our muscles release myokines, and these myokines are wonderful little hormones that help support the immune system and calm our nervous system, help calm inflammation, help repair tissue. It'll help decrease our stress hormones, such as cortisol. And we know that lots of stress creates an inflammatory environment in the body. So we want to work on trying to calm down as much as possible. Now, that's hard when you're going through a cancer diagnosis and you're going through cancer treatment. There's a lot to be stressed about. But we want to find some strategies that might help us manage that stress and help calm our central nervous system. So exercise is definitely one of those things. In addition to that, just supporting your heart and your metabolic health. So if we can help maintain a good body weight, we can maintain good blood pressure, we can manage our blood sugar levels, then that will also help decrease inflammation in your body. And as I said before, it's going to help you sleep, and we need to sleep. Sleep is super important. That is how we have opportunity to repair, and it is also helps to lower inflammation. So there's a lot of reasons to exercise. So then you might say, well, what do I need to do? So there's a couple of different types of exercise. Aerobic exercise or aerobic activity, that's where you're going to get your heart and lungs moving. And that is exercise such as walking, cycling, swimming. We then have strength training, which we need for our muscles and our bones. So as you get older, if you've gone through menopause, some of the treatment that you're having, it may affect your bones, even just by not being as active and as weight bearing as you normally are, can have effect on your bone density. And again, we want to keep your bones strong. So it's about preventing things not only now, but in the long term, such as preventing fractures and falls. So we need to do some strength training. We like and we try to encourage people to also do some flexibility and balance. So just maintaining just a few simple stretches, some balance exercises. Again, super important. The less mobile and active you are on a day-to-day basis, that may affect your balance. And when we're talking about preventing things, we want to maintain balance. That's really important, especially as we get older. So things like yoga, Pilates, stretching, and even just some straightforward balance exercises can be super beneficial. So you're probably thinking, well, what do I have to do and how can I fit this all in and where do I start? So what COSA, which is the Clinical Oncology Society of Australia, recommend is 150 minutes of moderate exercise, of aerobic exercise a week. So if we said half an hour, 5 times a week, we're going to get out and go for a walk or a bike ride or a swim. Twice a week, they recommend doing some resistance training. So using those big muscle groups and doing some weights or bands, and then some balance, flexibility. And that might be a daily thing where you just do a few stretches, come home from your walk, do a few stretches, do a few balance exercises. I try to encourage my patients to just fit balance into your day. If you're waiting for the kettle to boil, stand on one leg and just see if you can stand and balance for 10 seconds. So it doesn't have to be setting aside specific time. You might try to bring it into your day so it doesn't become so overwhelming of something that you're feeling stressed because you've got to try and fit this all in. Now, whilst that is the recommendations from COSA, not everybody is going to start with that level of exercise. So we do look at things like, were you an exerciser before diagnosis? What have you been doing since diagnosis? And, what do you like to do? So, there's lots of parameters that we'll work around to find a good exercise model. But I wouldn't recommend, if you haven't been exercising, that you suddenly go out and start walking for half an hour, 5 times a week and doing 2 sessions of weights a week. I would always recommend you start fairly gently and you build up. And where you start depends on where you've been. So it's not a one size fits all, but if in doubt, start low and slow and build up. So a little bit more about where do I start. So depending on where you're at, if you're super fatigued, you're having chemotherapy and it's really knocked you out and you just haven't been able to do anything, what I would encourage you to do is just try to start with even just a 5-minute walk. So the thing about getting outside, getting some fresh air, just moving your body, it will make you feel better. And what you might find is that if we say, let's just start with 5 minutes, that you get out for 5 minutes and then you actually go, I don't feel too bad. I think I could probably do 10. But you're always just going to start on the lower level and see how your body responds. If you do 5 minutes and you feel good and you want to go to 10 minutes, great. But what I would say is don't push to that half an hour that first time. Start off with just 10 minutes. See how you feel after the exercise. See how you feel the next day. If everything's feeling okay, then you go, okay, that's great. I can start with 10 minutes. And then the goal might be to slowly, over time, build up that time. So you might start with your 10 minutes, but over a few weeks, slowly build it up to 15 minutes and then 20 minutes and so on. If you're feeling super fatigued, short of breath, anything like that, obviously you would stop. So if you're feeling, your confidence is low and you're not really sure where to start, I would encourage you to take someone with you. So if you've got a family member and you can just say, let's just go out for a 5-10 minute walk. That's a good way to build your confidence and have someone there. But if ever you don't feel quite right, you stop. one of the things I think that is important about exercise is trying to find a routine. And again, that can be really hard when you're undergoing treatment and the side effects, and if you're having radiotherapy and it's every day. But if you can find a time, and often the morning is better, you might be less fatigued in the morning than you are at the end of the day. So just try to set aside that 10 minutes. I'm going to get up, I'm going to go for a walk for 10 minutes and start my day that way. You will feel better. It'll get the day off on the right foot, and you can slowly build on that. So in terms of other exercise, and with our clients, we always assess people. There's often other parameters of health, such as blood pressure, diabetes, other things that we need to take into account. Even from a cancer perspective, blood counts, particularly in lymphoma, where where are your white blood cells sitting? What's your infection risk? Do you have bone pain or any bony metastases? So as I said before, it's not a one size fits all. We need to look at each person individually and prescribe a dose of exercise, if you like. But if in doubt, start low and slow. So the gold standard, really, the way you want to think about exercise is just like you have a dose of chemotherapy and a dose of radiotherapy or immunotherapy. You need to think about exercise in the same way, that you need a dose. It needs to be prescribed, and that is because of all the side effects of the treatment and where you're at personally. And that's the way we operate. We like to assess people and then get them started with a dose of exercise that then gets revisited and reviewed based on how they've gone. But always progressing slowly. And important to check in with your health professionals. So if you are starting off into exercise and you're not feeling right, please talk about it with whoever is your next appointment, whether it's your oncologist, your medical oncologist, radiation oncologist, surgeon, if you have one, or even your GP. It's really important to keep them informed, and they can keep an eye on you as well and just monitor other life factors and health factors that may affect your ability to exercise. So when we're encouraging people to exercise, we want to work at a level that is safe. So with lymphoma, because it affects your immune system, we don't want to challenge your immune system more and cause any harm. So what we're not going to do is work at a really high level of exercise. We're not going to work at 7, 8, 9 out of 10. And what I'm talking about here is this particular scale, the Borg dyspnea scale, measures your shortness of breath. So what we would say is we want you to work at a level. Let's say you were walking, you could talk to somebody, and you could possibly even sing a little, okay? So it's important that you're not working at a level that you couldn't still talk. That would be too severe. So if you went out for a walk and you're feeling really short of breath and you're walking at a fast pace, maybe you just need to back it back a little bit. So we kind of want to work around the 2 to 3, slight to moderate. So yeah, I can still talk. I'm not gasping for air. There's another scale we use often with our clients, which is perceived exertion, where 0 is no effort. I'm not doing anything. 10 is I'm working as hard as I can. I can't maintain it. I've got to stop or slow down. So again, here, I'd encourage you to work more around the kind of, 1 to 4 sort of moderate level that you could keep going. You can feel a very slight increase in your breathing, but you could keep going. So that's the kind of level we're looking at with lymphoma. And that is because, as I said, we want to support your immune system, and we know that gentle exercise supports your immune system, but we don't want to stress it out more by working at a level that's too hard. So think, somewhere 1 to 4 out of 10 is if you're trying to gauge your perceived exertion, that's it. And the other thing about exertion is that on some days, so let's say you just had chemotherapy, and depending on what happens with your chemo, sometimes you're given steroids at the time, and that boosts your energy. So maybe on the day of chemo and the next couple of days, you're actually feeling pretty good. So those days, I could get out and I could go for a 20-minute walk and I'm feeling good. But then if you're not on the steroids or the steroids stop, and that quite often you hit a bit of a slump. And on those days, that sort of 3, 4, 5, 6 out of 10, that might be just getting out of bed and walking around the backyard. So you don't push yourself on those days where you're feeling particularly low. On those days, it would literally just be, I'm going to get up, I'm going to walk around the backyard, something. I would encourage you to do something, but it might be quite very light. And then as you start to feel a little bit better, a little bit stronger, then you can start to move a little bit more. So obviously there are times when we wouldn't have you exercising, and that is if you're anemic. So your red blood cells are really low. So you're going to be very tired, very breathless, and exercise can make that worse. So we're keeping an eye on that. If you've got a low platelet count, again, we're just mindful of increased risk of bleeding or bruising. So we might avoid the high impact kind of exercise. Definitely with an infection or fever, we're not exercising. And we're also looking at that from a lymphoma point of view, being mindful that your immune system is already under the pump. We may not recommend getting into things like a pool, what am I thinking of? A public pool where infection might be more an issue. So just be mindful of the choices of where you're at. And that just comes down to where you're at with treatment and where your blood count is, where your platelets are, all those things. Obviously, if you have bone disease or bony fractures, you can still exercise, but it's very targeted, and we would prescribe safe exercises. And it depends where the fracture is, but there's always something you can do. And then, of course, if you get very short of breath, chest pain, you stop immediately. You do not persevere. You speak to your health professional as soon as possible. If you're feeling dizzy, faint, short of breath, stop. Have some water, just sit down. It's not, we do see patients who come in who haven't eaten, who haven't drunk enough water, and they start exercising, and then next thing they're having a fainting episode. So you need to be mindful of just preparing your body to exercise. But of course, if there's any pain, any sort of redness, warmth, swelling where there could be a sign of infection, you're going to stop. Severe fatigue, exhaustion. And the other thing to take into account is your treatment. So if you're having a change in treatment, you may need to allow some time to see how your body adjusts to that treatment, and then reassess and then re-prescribe that dose of exercise. So just to summarize, exercise is safe and definitely recommended. It will help prevent the side effects of your treatment, which if we can do that, it may help you continue your treatment dose, which is what we like to see. It will help with your quality of life. There is some evidence out there to show that exercise actually helps the chemotherapy and the radiation do a better job by oxygenating the tissue. It helps the chemo and the radiation target the tumour in a much better way. There's also some other evidence. There's a lot of evidence in other cancers. So we have a lot of evidence in prostate, breast, and colorectal. There's not so much evidence in lymphoma, but it's coming. There's more research being done in that field with exercise specifically. But definitely in prostate, breast, and colorectal, we know that patients who exercise have a 30 to 40% less chance of recurrence of disease, which is very strong. So it definitely is something we want to think about. As I said before, exercise needs to be a part of your treatment, a dose, just like it is your chemo radiation. We know it can improve your immune function and it can help improve your mood, give you that sense of control. So what I would encourage you to do is try to think about exercise as being part of your treatment. Just like your other treatments, you're going to start low and slow, but we do progress, and we're aiming for a sort of moderate level of exercise. So we're not going into the higher intensities. We're monitoring for symptoms such as infection, shortness of breath, anything else. And you want to make sure you're consulting your health professional if anything doesn't feel right. Yeah. Okay, I think that's all from me. So I'll hand it back over to Liz. And if there's any questions, hopefully I can answer them.
Oh, thank you. Thank you so much, Sharyn. That was a very detailed overview of the benefits of exercising in a safe way with a lymphoma diagnosis. And I really liked your points that it's not a one-size-fits-all approach. And if in
No.
doubt, start low and slow. So we do have some good questions that have been sent through. The first one that we wouldn't mind you answering is, so do people do the same exercise during treatment as they have done before treatment? If you can just elaborate that one for us.
So probably not. No. So that's where, we would always assess somebody. So we do have clients who have been great exercisers pre-diagnosis. They may be gym goers, runners. But the thing is, when you get a diagnosis and you start treatment, that treatment causes side effects. So we want to assess you first for those side effects, as well as when you have an exercise break. So if you have stopped exercising because of your treatment and diagnosis, we wouldn't encourage you to go back to what you were doing pre-diagnosis. We want you to get there 100%, but you might start just a bit softer. If, however, you were exercising pre-diagnosis and you've kept going at the same level and the same intensity, you can keep doing that as long as you monitor your body. So if there's pain, if you're short of breath, any infection, something doesn't feel right, you wouldn't keep pushing. You would stop and get some advice. But so it always depends on where you've been pre-diagnosis, where you're up to now, but I definitely recommend exercising through treatment. So that's one of the areas where, as I said before, there's some good evidence to show that exercise helps the chemo, the radiation, the immunotherapy do a better job. But not only that, we're trying to prevent the side effects of those treatments. And so that's why it's important that you exercise through your treatment. Hope that answers that one.
Yeah, I think definitely. So our next question is coming all the way from Perth. So what are the next steps if you are unsure if it's the medication or normal day-to-day aches and pains that prevent you from exercising? So an example is that one of the medications I'm taking causes muscle and bone soreness.
Yep.
Is there anything that I can do safely to help ease the discomfort?
So the first thing I would say is that just movement is important. So the joint pain, the muscle pain is a common side effect of treatment. But again, we know that the stronger you can keep your muscles, the more those muscles can help support the joints and can help with joint pain. And just by moving your muscles is going to help that pain. So muscles need to move. So that's how we get blood flow to the muscle. We keep them flexible. We keep them working. So what I would encourage you to do is things like even yoga, Pilates, more mobility type stuff to start with. And then I would encourage you to perhaps look at, can you start building some strength if you've lost strength? And in terms of cardio stuff, if, for example, you say, well, I can't walk because I go for a walk and after 10 minutes of being on my legs, I'm tired and my muscles are hurting, then you look at some other options like maybe a bike, or if you've got a pool that's safe to get into, water is a great way to exercise and support your joints and your muscles. So finding ways to move is important, but you might just need to look at options that support your muscles so that you're not weight bearing possibly all the time.
Thanks, Sharyn. Next question. If you do too much exercise, does it actually ruin your sleep as well? I found if I do too much, I might be tireder, but not necessarily sleep as well.
Yes. So what's really important is pacing yourself. So whilst we want you to exercise, life still goes on. And if you are looking after a family or working and cleaning the house and cooking and doing all these other things, you're going to be tired. So if we then say, okay, let's get out there and go and do a massive exercise session, it might just tip you over the edge of, really what you can handle. So you need to pace yourself and look at what's your day looking like. So again, trying to find time where maybe you don't have to do everything in one day. So what I would say is try not to clean the house in one day. Don't mow the lawns and wash the car and everything. Pace yourself, and then see if on the days perhaps that you haven't got as much other physical things that you have to do, they're good days to look at exercise. And you might just need to modify. So if you're doing too much, yes, you're going to feel possibly more fatigued, more wiped out, and then not sleep as well. So it's just finding that balance, which can be really hard. And that's why I think just starting low and slow gives you that opportunity to see how it fits in with life, what we need to do with life. And then, okay, if you cope with something gentle, can I start to expand on that a little and not, cause myself distress? So pacing is important.
Thank you. Next question. I find my pelvic floor has really struggled as a result of chemo, causing so many bladder problems. Any tips for restoring pelvic floor health post chemo?
Yes. So drink as much water as you can to flush the bladder out. But secondly, you need to do pelvic floor exercises. So some of the side effects with the chemo on the pelvic floor specifically are that you might have urgency and frequency. You feel like you have to go to the toilet all the time, and it's urgent. There are things you can do for that. So there are exercises you can do to help calm the bladder down. And one of the best things to do is pelvic floor exercises. So for a woman, if you want to squeeze your pelvic floor, it's imagining that you're trying to stop passing wind. And for a man, if you want to try and activate your pelvic floor, you can think about stopping the flow of urine. I don't encourage you to do it every time you're doing a wee because you'll end up with a UTI, a urinary tract infection. But just imagining that you are trying to stop the flow. So imagine you were going to the toilet and you had a good strong flow and you had to stop it halfway. That's your pelvic floor in a man. For a woman, it's imagining you're trying to stop passing wind. Once you can locate your pelvic floor, then you need to exercise it. And it's like any other muscle. If we don't use it, it weakens. So you might, again, just bring it into your day. You might be sitting in the car at traffic lights and just say, okay, I'm going to do 10 quick squeezes on, off, on, off. That's a good place to start. So if you can maintain your pelvic floor strength, there are other strategies that can help calm the bladder down from an urgency and frequency point of view. It's probably a bit much to go into on this webinar, but I'm happy, whoever asked that question, if you want to contact me, I can send you some information on some strategies for that. But the goal is to try and calm the bladder down so it doesn't feel, it's not sending you an urgent message every time it gets a little bit of urine in there. So it gangs up a little bit on you, but yes, we can teach you how to help manage that a little bit better. Can't hear you, Liz. You're on mute.
Sorry. Are there any specific prescription guidelines for different demographics? So like age, yeah.
Yeah. So again, that's obviously what we take into account, younger people getting a diagnosis are usually, potentially, not all the time, but perhaps have been more active prior to their diagnosis. That's a big generalization. But yes, certainly we take age into account. But one thing I do want to say is you're never too old to lift weights. So, we have a lot of patients and, they look at me when I say, yep, we're going to do weights like I'm crazy, but I guarantee you are never too old to lift weights. And that's where we're not going to start you off on lifting 20 kilo dumbbells. We might start off on 1 or 2 kilos, but you can always do something and build up. So don't be scared to do weights. Our bodies are truly amazing machines and they adapt. So yes, we take age into account. And again, that comes down to what you can and can't do. You might not be able to do things because you're a little bit older and a little bit, maybe your balance is not good. So yes, 100% we take demographics into play.
Perfect. We have a good one, and this might resonate with a lot who are here. So I seem to have nerve damage from chemotherapy. Nothing drastic, but I'm unable to move my left hand arm in certain ways that I used to. It's like something's stopping me. Message from the brain isn't getting through. Can exercise help with that, or keep
Yes.
trying to push through?
Definitely. So exercise. So the chemo causes neuropathy. So it can cause tingling, pins and needles, numbness in your hands and your feet and your limbs, and can affect that sort of functionality. So exercise is super important. It's like we need to keep encouraging the message from the brain to the hand or the foot. So functional exercise is what I would sort of encourage you to do. Try not to ignore that limb, use it as you would normally. And then again, if you can see a health professional that can assess you and look at the muscle weakness there, they can then prescribe some like low dose strengthening that's safe for you to try to keep maintaining the muscle. Because what we don't want to do is have that nerve affect functionality that then affects muscle strength. So yes, definitely try to keep exercising. But if you're not sure and you're getting pain, like shoulder pain or elbow pain, I'd probably try to see somebody to get some advice around what is the best exercise for that particular thing. With the neuropathy and the numbness and pins and needles, that especially if it's in your feet, it can affect your balance. With your fingers, it can affect your fine motor control. So even things like just rubbing your fingers, massaging them, stretching, grip strength is important. And with your feet, things like curling your toes. Imagine you're trying to pick tissues up with your feet or your toes, calf raises, because again, that can affect your balance. If you can't feel your feet properly, then we want to work on balance. So yes, but for the arm nerve, I would encourage you to see somebody and find out specifically what are the best exercises for you to do for that arm, but try to keep using it as safely as you can.
Thank you. So this is one from Jeanette. I'm on watch and wait. Had splenectomy 2023. I walk every day between 40 minutes to 2 hours. I'm eating healthy. However, I still find it hard to lose weight. Could you give me any tips? I lost a lot of weight at diagnosis, but it's back.
Okay, so look, I'm not a weight loss guru, and I do hear this from a lot of patients. It's really hard. Again, I'm going to come back to muscle. The more muscle you have, muscle is higher in its metabolic rate. So it burns energy more. And so we need muscle. So walking is, of course, super important and excellent for your bone density and your mobility. But what I would probably encourage you to do, Jeanette, is keep the walking going, but not for 2 hours. Back on the walking and start to incorporate some resistance training if you're not already doing that. So the weights and again, depending on your age, once you go through menopause, and sometimes the treatment puts you into menopause if you haven't been there already. When we go through menopause, it's harder to build muscle. So we do need muscle. So obviously that, and then eating healthy, just make it, and I'm not a dietitian, so don't quote me on that, but just make sure like you're eating enough protein to fuel the cells that we need to do their job. But yeah, beyond that, sorry, I'm weight loss is not my super expertise.
We've got another good question. So, is it important to have a cancer physiotherapist or someone oncology trained, or will all physiotherapists be familiar with cancer-related exercise treatments?
So no, not all physios are familiar. So I would encourage you to see an oncology. Now you don't have to be a physio. You might have an exercise physiologist in your area who is oncology trained. But it does. It is really beneficial to see somebody who has an understanding of oncology because of the number of side effects and how they affect your body. So we need to make sure that the exercise prescribed is safe for you based on where you're at with your treatment. And not all physios generally, it's not our thing. We don't normally do oncology. So yes, you would want to see somebody who has the knowledge and the experience about what you're going through and what side effects and effects that is having on your body so that it's safe for you to exercise.
And just following on from that question, so if you are in searching for a physiotherapist or exercise physiologist, what are some good questions to ask to identify who might be well trained?
Well, I would just ask if they have any experience in cancer, cancer rehab. There's not a lot of cancer rehab out there, sadly. But that's probably all I would say is just, do you have any experience with oncology patients, so that then you can gain whether they have an understanding of, what the treatment entails, what the side effects of that treatment look like, and how that's going to affect you and what needs to be prescribed.
Okay, thank you. In terms of questions, so here's a question from Amy about, so my heart rate has become elevated, 120 to 130, resting since starting treatment. Can I still do those high intensity exercises?
No. So that's one where, Amy, we would really encourage you to stick with the lower intensity stuff. So if you've got a monitor, a smartwatch, you can monitor your heart rate. But we don't want it pushing up, too high. So you might need to look at certainly lower intensity cardio type exercise. So just your walking, some gentle bike riding, and then you could have a look at doing some light resistance. And again, you're monitoring your heart rate. So and obviously this is not easy for everybody to do, but with our patients, we will stick a monitor on them if they're at-risk patients, so we can just monitor their heart rate and also how you feel. How is that shortness of breath? How is, are you feeling dizzy? Are there any other side effects? But no, I wouldn't be doing high intensity exercise if your heart rate is escalating.
Probably last question. So this is from Daryl. I've been through chemo twice, first 20 years. I just finished chemotherapy in November. Through chemo, I was in a lot of pain all through my body, so I had trouble getting out of bed. Only now I've started walking. I finished up with nerve damage in the back, partly to do with 2 back operations. Is it common to have numbness to feet and fingers? So
Yes, so the numbness could be, if it's in your feet and your fingers, it could be that chemo-induced peripheral neuropathy. And that is a definite side effect of chemotherapy. And if you've had it twice, if you've had back surgery, depending on what effect that has had, that's not going to cause, depending on what part of your back, but if it's your lower back, that's not going to cause numbness in your hands. It could potentially be affecting your feet. So you'd have to get assessed to find out if it's the chemo or the back affecting the nerves to your feet. But again, what I would say to you is that you've got to try and keep those nerves active and moving. So, but especially if it's coming from your back, you've just got to do back safe exercises so you don't make the nerve pain worse. Now, for that sort of pain, you can definitely see a normal physio. That's what they do is back pain, back surgery, rehab. And if it's the neuropathy, then that's when you want to work on all those little toe, exercises, the feet activation, rolling your foot on a ball. I've got some clients who have those vibration plates they use. We also use at our clinic laser, and depending on where you are in Australia, you could look up MLS laser, it's called, and it is good for peripheral neuropathy. So there's not a lot out there for the neuropathy, sadly. However, things like acupuncture may help, reflexology, but certainly exercise does help, and there is evidence to show that exercise will help the neuropathy. So Daryl, yeah, I think you just need to try to work out if it's your back or the chemo-induced peripheral neuropathy, and then go from there.
Sharyn, I think we have our last question that's come through. Thank you for everyone for being so receptive in asking your questions. So this is following on from the heart rate issue. Can you talk a bit about shortness of breath? If you're struggling with shortness of breath, how can you be more active in terms of this side effect?
So you have to kind of again monitor that shortness of breath. So we don't want you exercising to that point that you're gasping for air. So again, it's just starting low and slow. So the shortness of breath might be because your heart's not functioning as well as it should, or your lungs might be struggling a little. Now that can be caused by a whole lot of different things. You can build it up, but you've got to start gently and safely. So you would just, if you can walk, you might just get out for a walk at a pace that you can do, that you're not getting to that point. So maybe walk on flat, avoid hills, just until you start to build up a little bit more sort of strength. And then you can start to push it a bit more. But yeah, shortness of breath is a big side effect. Can also be that you're anemic and you haven't got enough blood and oxygen pumping around the body. So I guess trying to find out what's causing the shortness of breath would be the first thing. And then secondly, then starting at a nice low dose that you can do comfortably, go for a walk on the flat for 10 minutes at a pace that you're not getting short of breath. And that might be pretty slow to start with, but that's okay. Just remember, something is better than nothing if you can do it. And if you're really anemic and you're really low with the chemo, then you might not get out and walk. You might be just doing some mobility exercises and looking at some other functional type things that you can do to maintain strength but not stress your heart and lungs at that point until things settle.
I think that is it. No more questions. So, thank you everyone for attending the webinar this afternoon. We really appreciate your time and hope that you have all been able to increase your knowledge surrounding the importance of exercise and also the benefits it can have in managing your lymphoma and your treatment as well. Thank you once again to Sharyn for sharing your expertise. It was very informative, and we very much appreciate your time. Also, I have learnt lots of things too while listening to you. If anyone has any questions regarding your lymphoma diagnosis or treatment, or are just needing more information or support, please reach out to us either via the email, so nurse@lymphoma.org.au, or on our nurse support line on 1800 953 081. We would love to see you again in any of our upcoming online or in-person support groups or future webinars or events. So keep an eye on our emails and events calendar for future dates. And we hope everyone enjoys their evening. Thank you very much. Thanks, Sharyn.
Thank you. Thanks for having me.